today I really just wanted to go over some general tips. I find doing talks about this is really difficult, and there's more value in hopefully doing as much of a discussion through question and answers as we can, since each situation is so different. But I always like to start out with this quote by Viktor Frankl, who, if people don't know, he was an Austrian psychiatrist. And unfortunately, during the Holocaust, and he and his family were sent to concentration camps. And he wrote a book called Man's Search for Meaning, which is really a lot of the basis of what we base our meaning-centered therapy on in psychiatry. And he has great insights if anyone's interested in reading about surviving things. But anyway, he says that an abnormal reaction to an abnormal situation is normal behavior. And I really like this because it basically means that when you're faced with something that is so out of the realm of your normal, that there is no right way to react to it. And that any huge amount of different reactions along a spectrum are really normal in the beginning. And so I'd like to sort of preface this talk with that, everyone's different. There's no one size fits all way to cope with things. But hopefully when we go through this, I can sort of give you an understanding of really what is coping, what are considered good ways of coping, and what are maybe not as helpful for you, and maybe can give you more ideas about other ways to sort of cope with your stress. So what is normal? This is sort of a funny idea, right? But I did look up this definition as far as, cancer goes. And really what's normal for cancer is that adjustment isn't just a one event. I mean, you guys probably know that better than me. It's ongoing, in which really everyone is trying to manage not only the patient, but the family, the emotional distress that you have over being diagnosed or what your future might look like. But then it's also about solving specific cancer-related problems, like I'm having nausea from my chemo, or my functioning isn't as good as it was, or I have neuropathy in my hands. And really the idea is to try to gain some level of control over these cancer-related life events, because everyone knows that when you have cancer or a chronic illness, you really don't have control over anything, and that's where a lot of distress can come in. So really to keep in mind, it's not a single event. So, people sometimes tell me, their friends or sometimes family think that, you have cancer and you're okay with it and you're fine. But actually it's an ongoing process, and there are multiple ongoing coping responses that you're having with each new stressor or each new barrier. And it's normal to have issues at any one of those points. So I sort of think this slide is a little bit funny, but what are the common periods of challenge when you're diagnosed with cancer? I mean, this just shows that for each person it's different, and any of these periods can be a period of challenge. And I even want to focus on the pre-diagnosis, because I've had a lot of patients come to me where they go to their PCP and something in quotes, looks funny, and then they might have months going through the diagnosis process. So even before you get diagnosed, there could be periods of increased anxiety. Obviously, when you hear that initial diagnosis, that's clearly a period of challenge, even if you might have been expecting it. Hearing the words, one of my patients told me last week, just hearing the words just makes it more real, even though you were expecting it. And there's a scenario when you initially get diagnosed where when you're told some bad news, your body's in a state of upheaval. You get a lot of adrenaline, you might get some anxiety, and your brain can't really process what's going on. So it's very common actually for people to say, my provider didn't tell me anything, where they might have told you, but you're just so overwhelmed with stress and having distress, as we sort of use in the cancer world, that you might not have heard it. So obviously getting the initial diagnosis is a period, and then treatment, with all of the side effects and how it affects your ability to function in life. And even post-treatment, even through remission, there's a lot of often fear of recurrence that can come up, which makes it hard to cope. Recurrence, obviously, the idea that you might need to terminate curative treatment, and then survivorship, which is actually a huge one. So there are a fair number of people who actually don't struggle at all through any of these first, 5 periods. But actually when everything's over and they're done actively, in quotes, like fighting or doing something to actively, get rid of the cancer, and they stop to think, wow, you know, I'm a different person than I was before, and how has that changed me, and how am I going to deal with this? So it's common to have common periods of issues with coping in all sort of, I call it the cancer journey, but through all the stages of the cancer journey. So what is really coping? You know, we use this word a lot, but really it's those specific thoughts and behaviors that we all use in an effort to adjust to things that are uncomfortable. And we're all doing this, you know, constantly. I mean, you can look at COVID and wearing masks, right? Like when we first started, I know for me, I like didn't want to go to Wegmans at all because I just thought, oh, I'm gonna have to wear this mask and it's gonna be awful and it's weird to have to walk in and wearing a mask and everyone's going to be looking. But you know, over time, it just, you went that one time, everyone else was wearing a mask, I sort of got over it and I adjusted until the next time, you know, the next time you have to go to a different place. So coping strategies really are, we sort of divide them into two main areas. There's the cognitive, so how do we think about things, and then behavioral, so are we doing any activities that help us cope with them. And we use different ones for different situations depending on what they are. And when they're sort of our innate coping skills, we don't really recognize it. It's usually when our usual ways of coping aren't working or they're limited by other things, when we sort of start having a lot more distress and issues. And then we think about coping in sort of the field as adaptive and maladaptive. So what's helpful for me and what's not helpful. And there are coping strategies which are more helpful and less helpful depending on the situation. And then there's sort of different ways people cope. So some people are really focused on the problem. I have a problem and I'm gonna fix it. And those people are sort of tend to be more, you know, cognitive. They, you know, not to be make generalizations, but you know, they're typically someone who might be an engineer or someone who is used to seeing a problem, coming up with a way to fix it, and being done. But then there's also the emotion focus. How do I cope with this new feeling of distress or anxiety or sadness that I'm not used to? And then meaning focused. You know, a common thing is my life is totally different than I expected. It's totally, it's not uncommon for someone who might have saved money their whole life to plan on this amazing retirement where they would travel and do all these things, and then they get diagnosed with cancer and they can't do anything. Any of that they worked their whole lives for, that, you know, they weren't going to find meaning in their later years in traveling and seeing the world. And so how do I find new meaning in this new life? So there's lots of different ways, and depending on what type of coper you are, in some situations you're going to do better than others. And this is just something to remind me to say again, that any emotion that you have is appropriate given everything that's going on. This is someone's, I forgot what these are called, but word graphic about cancer and all of the feelings that pop up. And so, you know, all of these emotions or feelings or thoughts that we're having, you know, they're okay. It's how we sort of react to them. And when it borders on the times when we're not functioning as well, or we're not getting enjoyment out of the things we used to, then it becomes a problem. So if anyone who's seen any of my talks knows that I love quotes, but I really love this quote also from Oscar Wilde, The Picture of Dorian Gray, which says, basically, I don't want to be at the mercy of my emotions. I want to use them to enjoy them and to dominate them. And that would be someone who's an emotional coper. You know, you have the emotion. We can't control the emotions that we have, but we control how we use them and how we feel them, and then how we can move on. So just another example of sort of great literary quotes about how to cope. So the coping styles, like I mentioned before, there's a few different coping styles we think of, and you can sort of think to yourself, what kind of coper am I? So there's active behavioral coping. So in active, you know, you're doing something. So these are overt attempts to deal directly with the cancer and its effects. So it might be actively seeking out friends and family for help. It might be, you know, taking up more exercise because you heard that exercise is better for your cancer, for your functional recovery. It might be actively deciding that you're going to change your diet. So these are active changes in your behavior that you are really focused on, you know, the cancer itself. And then there's sort of the active cognitive coping. So not directly dealing with the cancer and how you're going to focus on it, but thinking about what are your attitudes about the cancer? What are your thoughts? What are your beliefs? Identifying them and figuring out, addressing them or changing them if you can. And then there's avoidance coping, which at times can be helpful and at times not so helpful. But these are attempts to actively avoid the problem. So an example, or reduce the tension through distraction. An example of when this would be a good thing is when your mind is focused on cancer 24/7. We might recommend that you go take a walk or you go watch a movie to distract yourself, or to start up a project or things like that. So that can be really helpful. In other instances, it might not be so helpful, where you're not wanting to think about cancer at all and you're not paying attention to the things that you need to do in order to make the best out of the situation, or in order for you to fulfill the things that you want to do in life. So I marked in red only because most people agree that sort of active coping styles overall, people tend to do better than sort of avoidant coping styles. But like I said, in certain instances, avoidance can be helpful. So how are you probably waiting for me to tell you, right? What are good ways to cope? And of course, my answer is it depends. But there's certain things that we think about that overall, especially with cancer treatment and diagnosis, it can be helpful. Understanding the diagnosis and treatment for many people, just the information being clear and a way that they can understand really helps them get control over what they can do and what they can't do. And, uncertainty is really difficult for everyone, but, we always say, and I have that down here, try to focus on what you can control. And in order to do that, you need to understand what's going on. Now, of course, you have your people that don't want to know anything about the diagnosis, and that's fine for them, but really trying to get an overall sense of what is reality here. What is reality, and what is my maybe thoughts getting away from me, or anxiety. And then engaging your support system is really important and also really difficult for most people, especially if you're the caregiver type, the one who likes to take care of everybody else, the one who likes to, put on this face of being strong, and you're in your role in your family is the one to sort of be the one giving support. It can really be really hard to ask for it, but it can also be helpful sharing some of the burden. Cancer, in my opinion, is a family illness, right? It affects the person going through it, but it also affects everyone else in your family and often redefines roles. So engaging your support system and letting them help you can sort of take some of that burden off. Another one is expressing your feelings. It's very common for people to sort of like push them down because they don't want to be sad and they don't want to be that person, they don't want to be identified as sick. But a common issue is if you push them down, sort of like a boiling pot, things start to simmer up, and they can create issues outside that you're not ready to sort of, it creates issues, and then you can explode, and then you don't know how to deal with those huge feelings. Whereas if you would have just felt them in the time, right, felt them, and then were able to get control of them, you might have done better. This is also really hard for people. And expressing your feelings doesn't mean that you have to express them to someone else, because that makes you feel really vulnerable. But sometimes I tell people, just to get them out, it's okay to cry, it's okay to be angry. And if they don't feel comfortable doing that in front of someone, I sort of tell them, look, you're in the shower for 10 minutes. You can cry for your 10 minutes in the shower just to get it out and feel it, and then move on. Taking care of yourself also, these are all also very hard, and actually hard for everyone, whether you have whether you're diagnosed with cancer or not. But, it's really important to be able to take some time to unburden yourself with some of the other roles that you were able to easily do when you weren't diagnosed with cancer, and be able to take alone time or to take care of yourself, do something that you can to enjoy. And it's different for everybody. And oftentimes, I tell people that you actually have to schedule the time. Just like I would now with COVID also, it's really important, especially with people stuck at home and people being around each other all the time. It can be hard to find that alone time. So I encourage people to still make schedules and to block out the time and tell my husband or my kids, like, look, this is my 1 hour. This is me time and I don't want to be disturbed, something like that. Trying to focus on what you can control is a huge thing that often takes help from other people and practice. But, you know, cancer and COVID together are things that we don't have control over, and that can cause a lot of anxiety. But taking some of that power back and having what we call an internal locus of control, so having some power that you can do something, such as maybe changing your nutrition, that might help, or to limit your drinking, or to exercise, or to, you know, consciously make decisions about who you're going to meet with in the time of COVID and who you're not, can really give you some more power back. And then relaxation techniques can also be helpful. Now, there are some people who roll their eyes, you know, if someone mentions yoga or meditation. And, you know, that's not for everybody, but learning how to relax, how to shut your brain off can be really helpful. And there's lots of apps that can help with that and you know, can teach you certain ways. And, you know, I always tell people, just because one type of relaxation doesn't fit for you, doesn't mean that another one won't. So you have to sort of try things on a bunch. Distraction is another way, as long as you're not using it as your sole mechanism of coping, can be really helpful to just get your mind off things. Go have fun, watch a baseball game, something that, you know, takes your mind off of cancer, reminding you that you are not just cancer, that you have a whole life that you lived before, and that you have a family and things that are important to you. And, you know, you want to get away, you want to be able to distract yourself with fun things. And then the other most important thing is to really take a look at how you're coping. A lot of times, like I said before, we don't think about how we cope. We just do it. But sometimes it can help to take a step back and look at your coping and try to identify ones that aren't really working out for you. So, you know, it's very common for people to want, I don't know, a glass of wine at the end of the day. And that can be a really, you know, helpful coping strategy. But if you look and you find your alcohol use is increasing, and then actually it's leading to more fatigue and other things, that you might want to take a step back and say, well, maybe this isn't so great. I've had a lot of people who are active copers through exercise. So whenever something would bother them before they got diagnosed with cancer, they would like literally go out and run miles. Well, you know, who would argue with that being sort of a healthier coping skill? Well, when you have cancer and you're going through all these treatment, you might be overdoing it. So maybe in, you know, that situation, you shouldn't go run miles. You might identify, maybe that's actually making it worse. I'm in more pain. I'm having more fatigue. Maybe I need to do something differently. So identifying those bad coping skills can lead you in the direction to try to figure out what are new, better ways that might help me more. And then the other thing is, when do I seek help? So, you know, a lot of these things probably we think we can all do on our own. But, you know, when something you're used to coping in a certain way for like, you know, 50 years, and then all of a sudden those things aren't working, sometimes you need outside help. So the times that we recommend are, number one, anytime you feel like the strategies you are using aren't effective. But then if you have more significant depression or anxiety symptoms that are chronic and that don't go away, that would be a time to seek help. When we really worry about symptoms of distress or anxiety, it's really when it's affecting your life to the point where you can't function and get enjoyment out of it, and you can't live the life that you want to. Obviously, any thoughts of wanting to harm yourself or have active thoughts of wanting to end your life. It's very common for people to think about death when they're focused with a cancer diagnosis, so that's not uncommon. But when it's invading your every thought, or where you start thinking, well, maybe I should do something, that would clearly be a time to seek outside help. And then, like I said before, anytime something's not working for you and you sort of want another pair of eyes through therapy or through some other mechanism to learn other mechanisms of coping. So that's all I have for the talk. Hopefully I was able to keep that brief. So I think now, right, we're move on to the question and answer period. Is that right?
Yeah, if you want to start, I think there were some of the questions. Do you have some of the questions that I had emailed to you, or do you mean to pull those back up?
I do. Oh, Lord. I might need you to pull them back up.
Oh, that's fine. That's fine. I have some of them right here, so not a problem. Let's see. So one question that came in, how can I incorporate mindfulness into my day when I'm so worried about the future?
So yeah, that's a common problem, and obviously it's hard to do, right? When all you have all these worry thoughts. Mindfulness takes practice, which is obvious, not obvious to a lot of people. And so there actually are some great apps that you can use that really take you through these guided sort of meditations that some of them are Headspace, or I can probably send a list. Headspace or Stop, Breathe, and Think, or there's a bunch of mindfulness links actually on the Wilmot Cancer Institute site. But you really have to dedicate time, like I said, like a schedule, and say, for these 20 minutes, I'm going to be doing this mindfulness app. And it'll take you through relaxation strategies where you learn, but it's not something where you can expect to do it on the first try. So you need to give yourself grace and allow yourself to, maybe not be great at it the first time. And there's other techniques as well, like one called progressive muscle relaxation, which is more of an active skill. It's not that you're trying to shut your brain off, but you're constantly going through this squeezing multiple muscles throughout your body. So it takes the focus off of your mind and sort of onto that physical action. So that can also be really helpful.
Dr. Richman, we just had a question come in, and it says, I'm overwhelmed and find my temper is short, or I'm more impatient at times. What can I do to better handle myself during top stress times? So it's about stress, and how do I handle my, anger as well, or if your temper is short during this time?
Yeah, I mean, also a common problem. Well, first I would sort of look at the whole picture. Number one, there's certain things, right, that help us be less irritable in general. So are you sleeping well? How is your pain? Because obviously if you're in pain, that's going to make you more irritable. Are there things that we can do, like biologically, that are contributing to this, increased temper or being short? And then the other, the relaxation techniques can be really helpful. And sometimes I actually find, this might sound silly, but I sort of do this with my colleagues sometime if we're in the middle of a discussion at work or something, and I just find like everyone's temper is sort of getting up, and things aren't going anywhere. We sort of have like a code word that I'll say to my either my spouse or someone at work, where you can tell people's feelings are getting hurt and they're getting short, and we say the code word and everyone knows, like, you need to take some space. So I think that's another way. And the thing is with mindfulness and with calming yourself down is you really have to practice it in non-stress times too, because that's the only way you're going to learn the skill, so that when you're at that heightened level of stress, you can learn, because it's much harder, right, when you're up here, when you're ready to blow, to sort of take it back down. Also recognize your warning signs. So usually people don't go from 0 to 60, and quickly. In like shorter than that doesn't make any sense. But usually you go from 0 to like blowing your top, in the span of minutes. There's usually warning signs that you're starting to feel your body maybe give you some sensations where I'm getting irritated or sweating. And so recognizes those signs early, and then asking to take space or working on the relaxation can be helpful. So I hope I answered that question.
We have another one that just came in too. So a little bit of a similar question. This one says, many of us suffer from chemo brain. I have metastatic disease and get intermittent hormone therapy, which changes my feelings, libido, and cognitive ability. I read, do music, and an active life, but this is scary. Also, I'm no longer patient. So I'm not sure if they're just looking for some suggestions or thoughts that you might have on that topic.
Yeah. Sorry, it sounds like you are doing, obviously, all of the things. I mean, patience, right, is a hard thing also, because I think there are some people in general who aren't as patient. And so another common issue is if you're someone who's never been a patient person and might be easily to anger, it's not as much of a change for you than if you become that way, right, because of the illness or the medications that you're on. And so I think, you know, again, allowing yourself some space to accept that everyone's not perfect and we can't all be, you know, great all the time or patient all the time. And again, notice your triggers or warning signs, and then outside of those warning signs, work on ways, you know, to help calm yourself. Um, Again, we can't control, like I said, the emotions that we're having. We can only choose each time we might blow up or each time we might feel less patience to work on them the next time and think about the ways that we can make it better. Sometimes medications can help, like for anger outbursts or irritability, especially if you have that because of depression, and hormonal treatment can cause mood swings and can lead to depression. So that's another thing you might want to ask providers. Are there, especially if you're already doing all of the coping skills and you're already seems like you have, then maybe sometimes medication can be helpful.
Thank you. Our next question was, is there a common period when anxiety and depression peak when receiving something as a stem cell transplant? 6 months post, and I'm experiencing more of both now.
Yeah, there isn't a common period, at least in my clinical experience. You know, it's different for everybody, but I think what you're experiencing is common in that same thought of, you know, people like to use the analogy, which some people don't like, you know, you're fighting. But when you have that stem cell transplant, you're actively treating, right, the cancer. So you're doing something, you're taking control of it in some way. And then when you're in that survivorship period where you're not really actively doing things, you're just waiting, right? Waiting for your next scan. I mean, that can create a lot of anxiety. And so often when you're actively doing something, you don't have to think about all that. But when you have time to think, you're not going to the doctor as much. People find a less support in that survivorship period. That's when things can come to the surface. So it's very common for people to actually struggle more in the survivorship period. And that's when, you know, obviously gathering supports, but also sometimes counselors or therapists, just to have someone to bounce, you know, ideas off of or help you cope with that stress can be helpful.
Great, thank you. Let's see, what else do we have here? What should I do if I'm concerned that a loved one is struggling with their mental health during this time?
So very common also, right? We all worry about people when they're going through difficult times. I would say first would be to try to obviously talk to them about it. A lot of the times people aren't comfortable, obviously, talking about being vulnerable or struggling with mental health. There's still a lot of stigma around it. I always sort of start out these conversations, and sometimes we have them in my office with, you know, family members, is, you know, coming from a place of concern. You know, I'm really concerned about you. You know, I'm worried. And sometimes it helps to tell them how you're struggling, just to make it, you know, an open, equal exchange. Sometimes people feel like if you just tell, you know, say you're concerned, and that they feel like you're saying something's wrong with them, which isn't true. So I think gathering that information first, it can help also to, you know, sometimes support groups, people feel really that those can be helpful. So suggesting to them, or suggesting they might want to talk to their oncologist or have a referral to a therapist. But I think opening that line of communication, because it's not something people often talk about. And if they don't want to talk about it the first time, that's common. I just always leave the door open. And, you know, I don't even so much as tell people, you know, you need to check in all the time, because that can be irritating to the person. But just letting them know that, you know, I'm here for you if you want to talk about things. Like, this is really tough. I'm, you know, and I might say, I'm struggling myself, how to help you. You know, I want you to know I'm always here, that sort of thing. To know that they are there, that you are there when they're ready to talk, because they might not be ready initially.
Great, thank you. Sorry, my screen's freezing up here a little bit, and I apologize if I'm cutting in and out.
I have another one, Karen. There
Okay.
was a question that came in, and you kind of addressed it, Dr. Richman, about how sometimes anxiety or maybe depression can be increased actually when you start a treatment. And there was a question about someone starting a stem cell transplant and noticing sort of an increase in anxiety. So could you just talk a little bit more about that when you start to see, you wonder if you're anxious because you're doing the treatment, or are you anxious if there's something that's actually going on with your body and reacting to the treatment itself? So if you could just talk a little bit about, does that make sense to you?
I think
Okay.
so. Let me just rephrase it to make sure I get it. So how do you figure out if the anxiety that you're feeling is directly from a treatment, or whether, like, maybe you have a stomach upset, let's just say. You have stomach upset. How do I know if it's from the treatment, or if it's just I'm worried, I'm just anxiety and I'm feeling this physical symptom? Is that right? Did I get that?
Yeah, I think so. That's great. Yeah.
Okay. That's really hard to figure out a lot of the times because, you can look up all the side effects of a treatment, and, it's never 100%. So I always think to myself, why does it matter, right? Why does it matter? I'm feeling anxious and it's affecting me. So in my mind, I treat it sort of the same way. So what would I do if it was from the treatment versus if it wasn't? So how would we treat anxiety? Sometimes it's medications, and we can often use medication when someone's going through the treatment, especially if you need to continue the treatment, right? Because a lot of the times with these cancers, you can't just stop a treatment for side effects, and if there's no other option. So number one, I tend to treat it the same. Number two, we also, use the same relaxation techniques and therapies we would use whether it was from the medication or not. Now, sometimes when people get into trouble, though, is when they're told that they're cancer free, right? And then they start having physical symptoms, and they're convinced that it's a cancer recurrence. And even when they go to the doctor and the doctor tells them it's not cancer, again, they're still focused, they're still afraid. And so every time they get this feeling, their automatic thought is this is cancer recurrence. So that's a little bit different in that that's sort of more symptomatic of what we would call health anxiety disorder, which just means undue focused anxiety about health. And we still would treat it with antidepressants and therapy, but it's a more targeted therapy. So in my mind, I think a lot of people put sort of focus on what caused it. Unless the medication can be stopped, we sort of have to treat it the same way. A common example is steroids. So most people sometime in their cancer course are on steroids. We know steroids cause insomnia, they cause irritability, they cause depression, they cause anxiety, they pretty much cause everything. But most of the time, when someone gets insomnia or anxiety, we can't stop them because it's going to affect their treatment. So we treat them accordingly. We might start a medication, or we might teach them breathing techniques for when panic attacks are going to happen. We might do some targeted therapy. So we still want to treat it the same way. So I hope that answers that.
I think it did. Thank you.
Another question, which I think you probably answered this one a little bit too, but I want to make sure we get all the questions out there. Any tips that you have from getting sucked down the dark hole of depression, how to get it out of it once you find yourself there? Also, how to clear your mind of all the problems and anxieties and sleep at night?
Okay, so those are two very difficult questions.
Yes.
Number one, I think in some ways, clinical depression is a medical illness that, has many facets. Obviously, there's genetic, like anything else, environmental, and psychosocial reasons why someone would get depressed. And so if we're talking about clinical depression, sometimes it is not possible to pull yourself out. And so I want to make sure it's like in some people, there is nothing, they can do without extra help. But if we're talking about, sort of these thoughts where you get stuck in the negative and you can't get out of it, and you just keep every day sort of getting dragged dragged down further, then that's sort of a time when we would, number one, ask for help, but also sort of try to focus back on when we get stuck in negative thinking, that's sort of all we see. So sometimes I just tell people, like when they're in a hospital and they've been there forever and it's awful, you know, can you focus on five positive things that happened today? And they can be super basic, like, you know, I got outside in the sun today, or you know, I did this. Just sort of reframing so that when you have sort of depressive thinking, I always say you see the world through really, really dark sunglasses. And some of these skills, the idea is that we just want to lighten them up a little bit. So I'm starting to try to focus on other positive things. It doesn't change the reality of the situation, but it can help sort of reframe your brain to not be so on the negative side. Another thing is, you know, exercise or movement outside can really be helpful. We know you get endorphins, and I'm not talking about running marathons. I'm just talking about getting in the sunlight. Sun actually, you know, it's shown light therapy to improve depression. Also to really focus on the meaning aspect. So again, we can't control a lot of the cancer aspect. That is, unfortunately, is depressing a lot of times. But really focusing on, you know, thinking what's going to bring meaning to my life right now? What do I want to accomplish no matter what time I have left? How do I find joy in this moment? And then trying to do those things can also be helpful. So sort of focus on the active coping, which is the doing things, the cognitive coping, sort of retraining your brain not to only go the negative, but remind it that there are also positives. And then the 3 is the meaning focus. So all of those sort of coping skills can be helpful. And then not being able to be afraid to ask for help. Some people need medication or further ongoing therapy, and that's okay. And then okay, that was the depression one. The other one was, how do I get my brain to shut off? Correct?
Yes.
So how do I get my brain to shut off? Also common issue. And lots of people have different ways. And even though I'm telling you these, it doesn't mean they're going to work automatically. But one time is actually people give themselves time to worry. So for some people, you like literally schedule like an hour out of your day or whatever it is. And like, this is my worry time. Because a lot of the times when people are worrying all the day, they're sort of trying not to worry. And so they end up worrying. So you actually spend more time trying not to worry and worrying and all that stuff. So sort of dedicating worry time. And then outside of that worry time, anytime worries pop in, you try to refocus on something else. Distraction can also be very helpful. A common time when people have problems is right when you're not distracted, when you're not moving, when you're lying there in bed at night and you have nothing to do but think. So there's actually some sleep apps and the meditation apps that can guide you through things where they take your mind off of your worry thoughts with sort of mundane scenes or pictures. So that can also help. And then if it's to the point where one of the common questions I ask people is, how much of the day are you worrying? And people sort of look at you like, what? And I mean like, what percentage of the day are you worrying? How many hours? If you're worrying over 50%, which is like, 12 hours a day, these coping skills might not be enough and you might need medication. If it's 1 to 2 hours, then, you might be able to, handle it on your own. So recognizing it or asking your provider when they think it's over the point where these skills might help and you might need extra, ongoing therapy, which is very effective for anxiety, or medication, or both.
We had another question come in. Can you recommend a breathing technique or a breathing exercise to reduce anxiety?
So, common ones are just deep, slow breathing. And also I want to say, Diane, if you have other, I'm sure you probably do also, but if you have other ones or anyone else, feel free to shout out. But, really controlling deep, slow breaths, like taking 10 on the inhale and 10 on the exhale. It seems stupid, but that can be really helpful. There's lots of, websites also that will focus on techniques. The other one that I mentioned isn't really the breathing exercise, but the progressive muscle relaxation, where you literally sort of lie down like when you're in bed. And normally when you start out, someone will this is why an app is good, because they can read through, and they might say, start out with your, I'm closing my eyes because that's what you would do, but you would lie down and they'd say, start off with your big toe and squeeze that muscle for 20 seconds and then let go. And then move up to your, it goes through your whole body. It can take actually quite, 20 minutes. But that really helps because it, again, it's not focused on your breathing, but it's a tried and true exercise that can really help with anxiety. And if you Google progressive muscle relaxation or breathing techniques, then that can really help. Especially if you're, the breathing, especially if you're having panic attacks, because panic attacks are brought on by hyperventilating. So slowly counting out your breathing in your head, or even using a timer for the 10-second in, 10-second out, can be really helpful as well.
We had a question come in about being a caregiver. So I'll read it to you. As a caregiver losing a parent with a poor prognosis, how do you give them emotional support while still being honest about what's happening?
Mm-hmm. And I think, this is a good question. And I'm going to read into the question a little bit. So I think it depends on who wants to be honest. I think providing them support obviously is important, but I think there's also a lot of distress from both patients and families when someone doesn't really want to address maybe things that need to be addressed, such as like end of life planning, right? Or what they want to happen with finances. So I'm thinking that's maybe where the question is going. And so I think that open line of communication is really important. It often can help to, go, obviously now we can't go, but over video at least be in the room so that you can really get a great sense of what the actual reality is, as opposed to what your a family member might be telling you, and explaining to them, why it might be important for us to address these certain things, because, while also being supportive and making sure that they do enjoy whatever is, whatever life they have left. I think some people are afraid that if you talk about your plans that it might, bring death sooner. But I think just being open about it and saying, I really want to support you. Often the people who are sick are actually worried about their family members. And they're actually worried about making you upset about things. So opening up that communication and addressing it, can be helpful in letting them know that you want them to be around as long as possible, but we also want to be prepared so that everyone feels okay, and that so we can respect their wishes.
Looks like our next question that came in deals with psychiatry and mixing in with oncology treatments. So it's typical. Don't hear a lot of dealing with things outside the physical treatment, and the person's just wondering why psychiatry maybe is not part of a team in the overall process.
Oh, well, you're number one. Well, I don't. Again, in each place that people receive treatment, it's different. The field of psycho-oncology or psychosocial oncology is fairly. It's newer compared to all of these other things, and for places that haven't had the resource, or if they don't have someone on site, it can be very difficult to find someone in psychiatry who knows anything about oncology or cancer, in order to set them up with it. So I think at least where we are, our program's really young. But I personally obviously feel that mental health needs to be part of every every oncology evaluation. But oftentimes it's not, because, if you don't have mental health providers, people are, they just don't feel like they know what to do when someone tells them, so they don't even ask. But I think we really need to change that. And that's hopefully what we're trying to do, is really make us part of the team to, not only ask for people to see us when they're, really distressed, but also so that we can prevent distress, right? Also, sort of these kind of forums can be really helpful for us to not only, I think, we have to not only educate patients, but I have to educate providers on how I can be helpful to them and why it's so important to include them. So I don't have a great answer for that, but I'm hoping that, through all of these sort of forums and through our work, and at least at Wilmot, we can sort of improve that and really make it part of the team. And across the country, that is happening. It's just slowly. That's what I would say.
So I think that's all the questions that we've had come in. If anybody else out there has any other last minute questions for Dr. Richman, please just let us know. Again, you can type that right in the chat box. And otherwise, I think we're going to wrap things up. So we'll give everybody another few seconds to see if they have anything else. But in the meantime, Dr. Richman, thank you so much for joining us tonight. We really appreciate it. Diane, thank you also for being part of this tonight.
Thank you, Dr. Richman. Thanks a lot.
We really appreciate it. We hope that you stay well, and we appreciate you taking time out of your day today. Everybody, thank you so much for also joining us on the webinar, and we look forward to hopefully seeing you all next month. But thank you for joining us, and I hope everybody has a really great night.
Great. Thank you.
Thanks a lot.
Thank you.
Thank you. Take care.